All right. Well, hello, everyone. I'm Christy Strauss, broker sales manager at IAD. And today I am spending a few minutes with HAP's Director of New Business, Dustin Van Wyn. So Dustin's going to spend a little bit of time with us. I'm going to have like a short interview and ask a few questions about HAP's Medicare products. Dustin, thanks so much for taking the time and for this interview.
No problem. Thank you for inviting me. I appreciate it.
You bet, you bet. So we've been partners for a couple of years with HAP now. I think this was our full second year, IED, and our agents are loving the product. It just
Good.
keeps improving. So we just want to take this and just continue on and see that grow throughout the state. So the first question I want to ask is, tell me the advantages a HAP plan has for diabetics.
Yeah, we're doing a lot with the diabetes community, being really centered in Wayne County, which is one of the top counties in the entire country for diabetics. We really wanted to put a focus on that. And one thing with HAP is we're always trying to look at how we can invest back in our community. So about 6 months to a year ago, the Trump administration passed a new law regarding the senior savings model, which is basically to cap diabetic insulin costs at $35 through all phases. And this was a big move. So as soon as we heard like something about that happening, we're like, we have to jump on this. So we did add that to all of our plans. And I think that's probably the biggest thing you can look at is any of your members that are taking insulin for non-pump, because a pump CMS requires us to bill under Part B instead of D. But if they're taking insulin outside of a pump, this is a huge benefit. So we actually put it on all of our plans. We're one of the few carriers to do that, including all of our $0 plans. And so I've done a lot of price comparisons. And I know, for instance, if you're taking Lantus to JO, Novolin, Novolog, those big ones we are covering. A lot of people are taking Humalog or Humalin. If they switch to Novolog or Novolin, it's the exact same drug, just different pharmacy, PBM that's managing it. So if they're willing to do that, make that switch, we can save them thousands of dollars. I did a study with our underwriting team, and we ran, I don't know how many scenarios, probably about 50 to 60 scenarios of people on drugs through Medicare.gov, comparing our $0 plans to all the other plans in the market. And almost on every single plan, we saved a minimum of $1,000. Some of them are all the way up to $5,000 a year.
Wow.
People saving on their insulin. So again, that's probably the biggest thing, is that senior savings model being on our $0 plans is we're saving them a significant amount of money. So I definitely would put that as number one thing that we're doing for 2021. The other things that we're doing is covering their continuous glucose monitors. I mean, that's a big thing for someone that is on insulin.
Yeah.
And we are covering the Dexcom, the Libre, all as a $0 copay. So if they pick up from a pharmacy. We're also doing a lot with Pharmacy Advantage, who we use for mail order, so they can get their tier 1, tier 2, which now is an insulin, at a $0 cost share. So when it comes to that senior savings model, if they're willing to do the 90-day mail order through Pharmacy Advantage, they can literally get those insulins for $0 all the way through the donut hole. So that is a huge savings.
Yes.
We also have a lot of other programs we're doing for insulin. We're offering $0 podiatry visits. So that is a big thing for people that are diabetic, is their feet. Right. And so we are offering $0 cost share for that. As far as the care management, we decided when we were looking at this community is what can we do for the care management, not just the drugs, but what else can we do? And so we decided, for instance, if they're admitted to the hospital on discharge, we will provide them a 14-day supply of meals, because that is one of the things we heard from owned by hospital. One of their concerns is a lot of times when these people are discharged from the hospital, they don't eat properly. So they're admitted a week or two later. So we decided to add a meal delivery system for these people that are admitted to the hospital for diabetes. We're also partnering with the National Kidney Foundation to offer a diabetes prevention program. So we can do educational programs. We can hook them up with a nurse to basically educate them on how they can either lower their A1C or just help prevent it altogether. So a lot of programs, again, huge investment in this community, just because we are probably, of all the carriers, impacted the most, being centered right here in Wayne County.
That's great information. I did not know that about Wayne County being the number one, but I know that I have always talked to our agents about when they have their diabetic clients to please look at HAP first, because of their rich formulary for those drugs. But you've just given us even more reasons. So that's awesome. So Tier 6 is new for 2021. And I noticed you all have done some things unique with Tier 6 by including all the vaccines. Um, and that's also unique because I don't know any other carriers that are covering shingles, let's say, for example. I had a zero copay. But I want to ask, thinking forward, more about COVID, and if you all have forward thought about what happens if COVID becomes sort of like a flu shot. What happens if each and every year we end up having to go, hey, did you get your flu shot? What about your COVID shot? Have you all thought about that? And what do you think that might look like for the future?
Yeah, for sure. It's actually been a very interesting topic for the last year. So this actually all came together with covering vaccines under our Tier 6, which is a Part D benefit. So they have to get it at their pharmacy. I do see a lot of people still going to their doctor, and it's obviously not going to be $0 if they do that. But if they pick it up at the pharmacy, that Part D vaccine is a $0 copay. And it actually came up in January. We were doing our annual member reviews. And what I mean by that is every year we'll invite as many members as they want to attend an event. This year it's all webinars.
Okay.
And the question kept coming up that, hey, I go to get my shingles vaccine and I'm paying $40 to $100 and they can't afford it. So they're like, we're going to start skipping it. And obviously with shingles and many other vaccines, by skipping it, it can lead to a lot other worse and more
Right.
expensive issues.
Right.
So we decided early last year that we were going to cover vaccines even prior to this COVID really taking off in March. And so we made that decision as more of a preventative thing to start covering vaccines, the shingles, flu, hepatitis, and so forth. So yeah, it is a $0 vaccine. It does follow all the Part D and it has to be really done at the pharmacy. But yeah, COVID has definitely come up as what are we going to do with COVID? I know there's still so many questions when it comes to COVID is the vaccine is what's going to happen with it? How is this going to be covered? Right now it's completely mandated by the state and federal, so there is no cost to it. There's
Right.
also a lot of questions on how often. Being such a new vaccine, there is a lot of questions regarding that. And right now I'm hearing the vaccine could be good for 2 to 3 years. So maybe you won't have to get it every year. So I can't really answer that, yes, we'll cover it. I would say at some point, if it does come like the flu vaccine, which is I'm hearing it's going to be where you'll have to get it every year, yes, we definitely throw it under the Part D vaccines and we'd probably cover it. But I think right now it's so early into these vaccines coming out. And I don't know if all the studies haven't been released. I know that Johnson & Johnson is releasing a new one in the next couple of weeks,
Yeah,
but you hear
that's
it's only a
exciting.
70% success rate. That's a pretty high risk. So it's if we do cover the vaccines, do we only cover certain ones? So lots of
Okay.
questions regarding this, and I think it's too early to tell. And I would predict that even through 2022, it's still going to be a federal or state covered vaccine.
Okay. No, that makes sense. Oh, that's good. So HAP has some really great supplemental features, but one question that has been asked to me by agents is, does the partnership with Delta Dental act as a PPO, even if the client is on, say, like an HMO, the 15, the 015, which is the most popular of HAPs?
Yeah, so we have a really good relationship with Delta Dental, and we actually had some pretty large meetings the last 2 days with them on what we're going to do for 2022. We're getting very close to actually filing our 22 plans, which is
Oh
just crazy
gosh.
to think of.
Yeah,
Is we're just wrapping up 2021 enrollment, and we're already
right.
working on next year and trying to figure out what we're going to do. So we have a very good relationship with them. We've been with Delta Dental for years now, not really on the Medicare side, but all of our other product lines. So I would say we were one of the first carriers in Michigan to partner with them, and so it's been a long relationship with them. And so we have some opportunities and some things we're doing different. So when it comes to Delta Dental, it is really a separate entity. So all claims pass through them. It's really a buy-up, almost like a separate product, even though we embed it with the HAP plan in a lot of situations.
Okay.
But when it comes to Delta Dental, it is on the Medicare Advantage side, it is a PPO and Premier network. So what that means is when you're buying it, if you were to look up the Delta Dental dentist on their website, on the Delta Dental Michigan, you're actually looking for Medicare Advantage, PPO, and Premier. It's two separate networks.
Oh,
It's only one plan, but you're really getting both networks. So a lot of companies will say, hey, we have the PPO Delta Dental, which is not as large. We actually have the PPO and Premier. For our clients on the HMO plan, since it's actually a separate policy, even though we're adding it as a rider, it is a PPO. It's the PPO and Premier Network. So they have coverage through all of the Delta Dental dentists. I recently heard a statistic that, one of the competitors here in Michigan, I'm not going to mention the name, but it's Blue. They have a great dental plan. And so Delta Dental actually came out and showed how they actually have 70% more of the dentists that seniors are seeing than that plan. So it is a very rich benefit. And I would say more dentists will take Delta Dental than any other company, which is great. And on our PPO, the way it operates a little different is, so on the HMO, yeah, it's a PPO, it's the Premier Network, but on the PPO plan, our PPO plan, our Medicare Advantage plan, if you buy that, you actually can go to dentists that don't even participate, and they're actually covered too. So that's the only thing difference between if you buy the HMO Medicare Advantage versus the PPO. They're both covering the PPO and Premier Network. It's just the PPO actually will cover dentists that are not even in Delta Dental's network, but that's really only, I think it's 3% of the dentists in Michigan don't take insurance. So actually with our plan, they would still be covered on the PPO plan.
Okay, gotcha. Wow. I didn't know that part. So that was good information. So I know for 2021, you all extended the counties for Dsnip, which is really nice. Start out in just Genesee, and now we've got Wayne, Oakland, and Macomb County. So can you give me like the top 3 things to look for when you're selling a Dsnip?
Yeah, so the Dsnip market, when you actually look at Michigan, is relatively new. I mean, you have every carrier jumping in it last minute. I mean, it's been around for a while, but from a carrier standpoint, no one really sold it. I mean, Priority jumped in last year with the whole state. I think it was last year, this year. You got Aetna jumping in it. Now I hear they're going to go across the whole state next year. You have WellCare. So Dsnip is really taking off. And why? It's because most of the people on Dsnip are either on a Medicaid only or original Medicare. So it's a huge opportunity. I heard as many as 90,000 people in Wayne County alone could be enrolled in the Dsnip in the next 2 years. So you're talking a huge opportunity for agents. So we are making a run in the Dsnip market. However, there's really, when you're looking at Dsnip, you got to be careful. It is a very vulnerable population. And one thing I've heard from agents when it comes to the Dsnip population is retention is really bad. And so we did a ton of research, and we started off by actually hiring the person that has started 5 MMPs and Dsnips for the national carriers across the country. So we kind of said, hey, if we're going to find someone, let's find someone with the most knowledge in this. And so when we hired her, we said, the one thing we hear from agents is why they don't want to mess with this market is they enroll them today. And it used to be a month later, they would leave. Now, at least you have them for 3 months. But it still falls under rapid disenrollment. So you still could be losing all your commissions. And we asked her, why do these people leave? And her number one reason was, first, customer service. The Dsnip population is a high touch population. They call in constantly, a lot of medical situations in most cases. They need a lot of hand holding. And another reason agents don't want to deal with that is it's a lot of service work. But if you sell a company that has great customer service and is doing those outreach to your member constantly and holding their hand, you shouldn't have to worry about that as an agent. So our number one priority when we launched our Dsnip back in Genesee County about 2 years ago was we are literally going to handhold these clients. So we do a quarterly outreach to every one of our Dsnip population. In the first month of enrollment, they will get 3 calls from us. And we actually will call them until they answer, or we leave a voicemail basically saying, tell us not to call you. And we're doing a welcome call. We're basically saying, how can we help you with any of your medical situations? How can we coordinate that care? We really want to be that hand-holding company. When it came to COVID this past year, we called every single one of our members between March and April that had a Dsnip plan and said, okay, how are you impacted by COVID? Are you able to get to a doctor's office? Are you able to get your prescriptions? Are you able to get food? A lot of people in Michigan actually live more than 20 miles from a grocery store. So it's like, okay, how can we make sure they actually get food? So one thing we're doing that's going to really separate us is we're hand-holding our Dsnip population and making sure they have the benefits they need, which is very different. A lot of companies say, hey, we're going to sell on these rich benefits, but our customer service isn't going to be the best. Well, with Dsnip, you can't do that. With Medicare Advantage, it's probably not a big deal because they use it maybe a few times a year. Dsnip's not like that. They're using it every single week. So customer service should be your number one priority as an agent.
Good point.
The second thing, and I kind of mentioned this, is that care coordination. This base, their main concern when they have a plan is their medical situation. Maybe they are diabetic, but maybe it's something else. Maybe they have hypertension. I mean, there could be a lot of things. It's how is the carrier going to handle that medical, and how are they going to coordinate to make sure they're getting the right care when they need it. And we've made a huge investment into that to make sure that our clients, when it comes to their care coordination, are getting that 4.5 star rating that we have on our plan. And a lot of agents say, well, how do you have a 4.5 star rating on a Dsnip that you only had for a couple years? And that is that customer service. It's that care coordination. I think we're one of the few carriers in Michigan to have a 4.5 star on a
Oh, that's
Dsnip.
great.
The
Wow.
third thing I say is, when I'm looking at Dsnip, I see all these companies offering $3,000 in dental, $4,000 in over the counter. And why isn't HAP doing that? And I say, because if we do that this year, next year, there's going to be a company that's better. And the year after that, there's going to be a company that's better. So clients that are chasing that Dsnip supplemental benefit, what do you think is going to happen? They are constantly going to leave. And agents always ask, why is my retention
Good
so bad
point.
on Dsnip? Because the consumers that you're selling are chasing those rich benefits, are shopping every single quarter for a richer benefit. They use up their dental with this carrier today. They move to plan B
Gotcha.
next quarter so they can get those benefits all over again. So we
Yeah.
decided that we don't want to work with that population that's chasing those rich supplemental benefits. We want to work with a population that is looking for the help, looking for a company that's more community-based, that cares about them and can help manage their care. If they're coming to us saying, hey, I need $3,000 in free over-the-counter benefits, which I don't know how they even get that many toothbrushes,
Yeah.
we're not that company. We're
Right.
that company that they're going to buy, they're not going to leave, and that's why our retention, our Dsnip population right now is about 93%. You
Oh,
talk to
that's
most people,
great.
you talk to most companies about their Dsnip population, it's like in the 60s to 70s.
Oh my
And
gosh.
so when I tell agents, I says, if you're selling a company, do not sell on supplemental benefits. They will not stay with you and your commissions will just get reversed because of those
Right.
advances.
Yeah.
Also, look for companies with great customer service, and we're not the only one. There's all other local carriers in Michigan, that Green Company, great customer service.
Right.
And then also look at that care coordination. I think that's really what's going to separate it. So if you look at those three things and you sell on those three things, your
Mhm.
retention will be there. It's not the easiest sale because you're not
Right.
selling on those gold benefits, but I'm
Right.
telling you, your retention will be way better, and you won't have to every single year throw 100 new clients on the books just to keep your retention up there.
Well, that's great advice, and I'm sure well received by the agent population. So thanks for those three tips. So the other thing is that seemed to be newer for not just HAP but some other carriers, is the value-based enrollment. Um, I know for some agents it was a little tricky. The Ascend platform um, is maybe a little clumsy at first, but can you expound on why you all wanted to go with the value base, the VBE,
Yeah.
and what that's all about?
Yeah, so there's a thing called an HRA, which is the health risk assessment. And health risk assessments are part of the star ratings. They've been around forever. And it's always been one of those things that carriers would mail them out to their members,
Mm.
usually in that first month of enrollment, and we would get like 5 to 10% of those back.
Oh,
And so it's been a very low response rate, but that's how we impact our star ratings. And that's how we actually work closer with the member to coordinate that care, to give them more the hands-on experience. And the reason a lot of people buy Medicare Advantage plans is they want that coordination of care. And we can't do that without having that health risk assessment. So this year we did look into a lot of companies that did electronic health risk assessments, and Ascend calls it the value-based enrollment. A lot of other companies just call it the HRA platform.
okay.
And so we were already using the Ascend platform, and we do love it. It's been a challenge sometimes to kind of figure things out, especially when you invest in new technology. I think at this point we finally worked out all the issues, but we made a huge investment in going with the value-based enrollment and allowing our agents to do that HRA and help their consumers with it. So right now, as of today, and we're talking on February 25th, it is a where you're basically scheduling it for the member. They get a
Okay.
phone call and they complete that 10 to 15-minute survey, which is the
Gotcha.
HRA form, and then we pay the agents a fee. Right now, it's $50. We are
Okay.
over the next couple of months going to go to a point where agents will actually be able to complete the HRA or the VBE on behalf of the consumer, just to make that process a little easier. And also we want to up the number of HRAs we're getting. Hopefully someday we'll get to a 75 to 80%. Right now we're actually at about 54% of our enrollments. The agent is using the VBE tool. So I think from an agent standpoint, there's two things. One is you're building a better rapport with your client because HAP is literally having an outreach to them within the first usually couple of days of them buying our plan. and finding out, what's going on with your medical situation. How can we coordinate that care? Who's your PCP? Let's just make sure they're on the same page as us. And so I think that member experience by doing the VB, it actually is going to help you from a retention standpoint. I have heard from agents, just to be blunt with this, is that, there's some questions that really throw them off and make the consumers feel uncomfortable. So we actually went through about 3 weeks ago and revamped our HRA questions the way we're asking them. We actually removed 2 of them
Okay.
just because they were making members feel uncomfortable. And that's not what we want. We want them to feel like they're providing the information that will help their care. So
Sure.
it has gotten a lot better. And I think hopefully agents will start looking at that and using it a lot more. And we can provide those questions at any time
Oh, great.
whenever an agent wants them. But
Okay.
that process for the agent is to build that relationship. It's the compensation. You can extra $50 per VB, complete
Right.
with some extra money. From a consumer standpoint, it's that care coordination, that experience. They know that they're enrolled now because they're getting that call within the first few days of enrolling. And then from a carrier standpoint, it really is, us trying to outreach to the member and make sure we understand everything going on, especially now that we have to accept everyone with ESRD, not really accept, but that we're working with people with ESRD. It
Right.
helps us to know that up front, okay, how are we going to work with them? How are we going to coordinate that care and make sure that everything they're getting they need in those first
Okay.
couple months? Otherwise, it's not 6 months to a year later where we
Right.
start getting those claims fee. We actually realize those. It also helps us a ton for the star ratings. So, to
Okay.
keep that 4.5
Great.
star, which gives us extra money to invest back in the plan, we definitely want to complete the HRAs or VBE if possible.
That's good information. And that's just something for me to then pass along to the agents because there is value in using the value-based enrollment.
Exactly.
So that's great. One of the questions that came up is most of the hospital systems in the Southeast, Southwest Michigan's take HAP plan.
Mhm.
But are there any other hospitals right now that are not included that you're looking to maybe partner up with? And what does that look like for the future?
Yeah, I mean, we're constantly adding providers and doctors. It's a never ending thing. Doctors, especially nowadays, offices are constantly selling. They're selling to larger practices, so it really is almost daily changing. And I hear a lot of agents saying, "Well, I checked the doctor and it was in network, and 2 days later, it's not because they sold their practice or they retired." So the provider industry is changing drastically. We actually just hired a new VP of provider contracting. Super excited. He's been around the country doing this and very
Oh,
well
wow.
known. So hopefully that's going to help us get even secure better contracts for better pricing. As far as the hospitals go, I would say, we operate mainly in the 30 county area, which is East Michigan all the way to like the Lansing area. And
Mhm,
then we go north to like Midland, getting close to Mount Pleasant, and then down to
mhm.
Hillsdale, Jackson. And so if you take those 30 counties and not talking about West Michigan yet, but you take those counties that we're in, we're going to have every single hospital. The only hospital in those 30 counties we currently don't have, and hopefully that'll change soon, is McLaren Lansing. So we have all the other McLarens, just not the one in Lansing. We had a special relationship with Sparrow there, so we went with them instead of McLaren, and that eventually could change. There's a lot of, again, things happening from the providers selling to different entities.
Sure.
So that would be the only hospital in those 30 counties we don't have is McLaren Lansing.
Okay.
Obviously, we're owned by Henry Ford, so that's huge. And Henry Ford is, I would say, buying hospitals left and right too. So there's some major expansions that going there. They did buy a hospital out in Jackson about a year ago, 2 years ago. So now we have the hospital system in the Jackson Hillsdale area. So you're going to constantly see that being owned by Henry Ford. They're going to be buying up hospitals, which also helps from us. As far as West Michigan goes, because I know you have agents over there,
Yes.
we currently have a really good relationship with the Mercy Health System, which is they have hospitals in Kent County, Ottawa, and Muskegon. Muskegon is their main spot, and I think actually the last number I heard they have a 95% market share in Muskegon County. So with that partnership, we've done very well in Muskegon. And hopefully, I think we're crossing a 20% market share right now, and we've only been there over a year, just over a year. So, I mean, that's been great. The big one over there, as everyone knows, is Spectrum. And that is
Yeah.
definitely a hard hospital to get into. We're working that. I don't know. I can't ever say that it's going to happen next year. It might be 10 years. It might be 2 years. It might be 2 weeks.
Right.
We don't know what's going to happen with that, but that's definitely a relationship we're trying to form and see what we can do there.
Mhm.
And hopefully next year, this time I'll be saying, yeah, we have Spectrum now, but I just
Right.
don't know.
Right.
And then when you get down to south west Michigan, you have like Kalamazoo County, and we're working
Right.
some things there. We did enter in January this year into that area. We have two of the major, two of the major hospital systems there. There is one more we're working on, and we hope to have that secure over the next few months.
Oh, good.
So definitely making some expansions there, and I am pretty
Right.
excited about where we're going and the direction we're going in. But the provider experience is ever changing with today's world.
Right. And that will help with that agent market growth, the agent distribution, as you add those hospitals in those newer counties out by Calhoun and Kalamazoo and those areas. So that's exciting. Um, so, and then one other thing I just wanted to ask about, I mean, I'm aware of it, but maybe just touch on the marketing pieces. You all have some really great marketing pieces, but what do you have available for agents that, you know, we as an FMO can help and customize, but what do you have and how would an agent go about obtaining those marketing pieces?
Yeah, so right now on the HAP agent portal, so if they go to their hapagentportal.com, I think it's
Mhm.
.com, there is some things on there that they can personalize and put their
Okay.
name on. We are working on adding a lot more pieces. Right now, what I've had agents do is just saying, hey, you guys have this flyer, like right now, last week, we have the $0 HMO versus the $0 PPO. It
Okay.
basically talks about both plans, the benefits, and I had an agent request to, hey, I want to take the 1-800 number off this and I want it to be my number, which is makes sense.
Yeah.
And so a day later, we had it for them. So,
Oh,
I mean,
nice.
that's kind of the way we work is if you see any type of piece,
Mhm.
anything
Yeah.
that has HAP on it, we have no problem within a day or two
Okay.
removing the 800 numbers and making it where agents can put their name and phone number, their email. So that's something easy we can do. And then what I do is I usually provide you the PDF. Agents can
Okay.
bring it to any office max and get it printed. I've had certain situations where we've done some printing for agents. It's like a co-op marketing program. So we can
Gotcha.
definitely do something like that. But I would say anything you find out on our website, I know I've sent out a ton of emails with attachments with
Yeah.
different pieces. If you come back to me and say, hey, you know, I really want my contact information on this because a lot of it has the 1-800 number, just let me know and we can definitely personalize it for you.
Oh, that's great. That's good to know. And just for you agents that are listening out there today, you can also come to me and we can take care of that customization too at IED. So well, that's really all I have, Dustin. And I really appreciate you taking some time today and answering these questions. I think this was valuable for our agents. And it's not the same old webinar where they're looking
Yeah,
at slides and not that they really want to look at my face, maybe yours, but maybe not mine.
probably
But
not.
nonetheless, it's a little bit more, interactive, if you will.
Mhm.
And so we're real excited. And again, we appreciate the partnership.
No problem. I appreciate the opportunity. Like I said, we're always here to help. So any questions agents need, Jason or myself, they can reach out anytime. And we're definitely here to see if we can help them, even with marketing ideas or thinking outside the box. That's what we're here for.
Perfect. Thank you again.
Yep.
You have
Thank
a
you. Have a
great
great
day.
day.
Okay. Bye.